Welcome everybody to this week's edition of the Policy Corner for the 2021 legislative session. This is Andrew Riggle and I'm Nate Krippis. Here's what's coming up and what went down.
A couple days ago, we spoke in support of Representative Romero's HB 84 and HB 162. In both cases, we urged the committee to go a little bit further because the HB 84 requires the police departments to report data to the Bureau of Criminal Identification, but several national groups encourage states to report such information to the federal government and the Department of Justice, and we think that would be good practice for Utah as well. HB 162, Representative Romero requires 16 hours of training in de-escalation and crisis response every year. We are supportive of the idea, but again urge the committee to go further because national data shows that 16 hours is about the average across the country for that kind of training, and we feel that Utah is in a good position to and would be well served to go above and beyond the minimum.
So there are a couple other bills that we've mentioned in previous weeks. So SB 92, Senator Harper's election bill that would do a study to see the feasibility and what it would take to provide at-home options for voting, electronics, so that voters with print disabilities would have the ability to do so. That went through committee this week, and so we're pleased to see that moving along. Another bill, SB 70, Senator Reeby's mobile crisis outreach team bill that would expand the number of mobile crisis outreach teams, or MCOTs, in the state of Utah. Unfortunately, that bill had a little hang up in House Health and Human Services. Representative Elison had some concerns. I think he wants to work with the sponsor on it, so we're hopeful that bill can still move this session. Just kind of wait to see what the representative and the senator can work out to expand MCOTs in the state of Utah.
And just wanted to highlight a couple items for you on the Social Services funding priority list. If you get a chance to contact your representatives or members of the committee over the weekend or on Monday to let them know of your support. One is the Representative Elison made two requests related to the DSPD waiting list. One is for folks who have critical needs and are near the top of the waiting list, and that's $2 million to bring them into services. The other is almost $10 million request for folks who are not yet close to getting into services, but who could use the support to remain at home or active in their community, and that could involve things like respite care, a continuation of caregiver support, assistive technology to allow somebody to be maintained in their current environment. And we really appreciate Representative Elison for being a strong champion for both both of these pieces of the puzzle over the last couple of years, and teaming up with Representative Thurston to promote the limited supports waiver, which hopefully will be operational fully within the next couple of months, which will add additional capacity to the system. The second item that we wanted to highlight is a restoration of funding, which was secured last year but got cut during the COVID special sessions, and that is to provide transitional services to folks leaving the Utah State Hospital in Provo, and that would include an assertive community treatment team, basically bringing treatment and supports to the individual rather than making the individual go get that treatment or support on their own, and also providing them with supportive housing, both with the intention of making sure that they have the supports that they need to remain in the community and not return to the hospital.
Two other items that we're watching in social services. Again, as Andrew mentioned, depending on when you see this, either over the weekend or possibly on Monday, reach out to your representatives about these things. Two pieces from our settlement. We're watching the restoration of some funding to transition folks from intermediate care facilities into the community. We're hoping that will get funded, as well as quality improvement incentives for those intermediate care facilities. So the folks who remain, just improved conditions and fewer people per room, things of that nature, which would really help prevent spread of disease, as we've seen over the past year. So a couple of things to watch out for.
Just a reminder that we are still watching all of the law enforcement bills and wondering, just like everybody else, which one will be the one that actually moves forward. Similarly, we are hearing that the bill on regulating youth residential treatment facilities will be coming out to committees sometime next week. So we will keep you posted on both of those. In the meantime, we have seen many more bills get text this week. So we fully expect full committee agendas from here until the end of the session. So keep an eye on the bill tracker on our webpage. Similarly, the appropriations committees are beginning to wrap up their work early next week, which means that the budget conversation will move over to legislative leadership. So keep your eyes peeled on our budget tracker to stay up to date with the latest there.
Well, that's like we said, that's what went down and what's coming up. So thanks everyone for watching, and we'll keep you posted on next week as well. So thanks.